So first, a little bit about me. My name is Lexi Oaks. I'm currently a senior at Magna Vista High School. I will be attending Roanoke College in the fall, where I'll major in biology on a preclinical track. So why this topic? I chose this topic because I plan to pursue a career in orthodontics, and I also chose this topic because most of us in here have probably experienced a cavity before, and I think that this study could be beneficial and educational. So first, what causes a cavity? Eating or drinking sugary, chewy, or foods or candies or drinks can cause a cavity, or also acidic foods such as limes or lemons. And then also personal hygiene. So eating foods and drinks that are sugary or acidic like this can create a bacteria called plaque. Plaque gets in between or on your teeth, and if you do not brush or floss regularly, then the plaque will stay in your teeth and essentially cause a cavity. So first, let's talk about the cavity evolution process. So the first step in the cavity evolution process is demineralization. This is the early stage of tooth decay. This is where the outer layer of the tooth loses minerals and due to acid exposure. And this is usually noticeable through faint white spots and can be reversible through fluoride treatments, so brushing your teeth, and other oral hygiene practices. The next one is enamel decay. So this is where the enamel weakens and breaks down. So this is where tiny holes or cavities are present in the tooth, and at this stage it is not irreversible and will need to be professionally treated. The next step is the dentin decay. So this is where the decay reaches the dentin. The dentin is a softer, more sensitive layer underneath the enamel, and because the dentin is deeper, you may experience more sensitivity and pain when eating hot, cold, sweets, or chewy foods. And then between the dentin decay and the abscessive formation is when the decay can reach the tooth's pulp. And this is the innermost part of the tooth and can cause significant pain and inflammation. And at this time, a root canal would be necessary to save the tooth. And the last step is abscessive formation. So this is where the cavity extends past the tooth's pulp, causing an infection known as an abscess. And this can cause severe pain and swelling, and an extraction of the tooth would be necessary at this time. So importance of consistent dental care. So first, let's talk about what a regular and non-regular patient is. A regular patient is somebody who regularly attends their 6-month cleaning at the dentist's office, and then a non-regular patient is somebody who does not attend these regular dentist patients and only comes for necessary needs or emergencies. As stated a little bit before, plaque is bacteria that can get in between and on your teeth, and if you do not attend your dentist appointments regularly, then this can essentially cause a cavity, as I said before. And then some results of inconsistent dental care. So first is gum disease, and this is when plaque buildup can get in the mouth and can cause an infection that damages the gum and bones, and can cause high pains in the mouth and must be treated by a dentist. Something else that might be a result of inconsistent dental care is you might have to resort to getting partial dentures or actual dentures, which are removable fake teeth due to tooth loss. And then another thing is that you may have oral cancer and never know it. So according to the National Institution of Aging, people over the age of 40, particularly men, have a high chance of having oral cancer and never knowing it. So these are only some of the reasons why consistent dental care are important. So why might someone be a non-regular patient? So the number one reason why somebody might be a non-regular patient is due to accessibility to health care. According to the oralhealth.gov, 62% of older adults do not have dental insurance. Another reason why somebody may not go to the dentist is because they have dental anxiety. According to the National Library of Medicine, 36% of the population have dental anxiety or fear, which is a cause of why they do not attend the dentist regularly. And then lastly, it's just simple laziness. So some people don't attend the dentist's office because they think they don't really need to go and they don't feel like going, so they don't. And this leads me to my research question. How does attendance in the dentist's office affect cavity rate in patients? So for my hypothesis and aside, so my null hypothesis is that cavity rate in regular and non-regular patients equal each other and there's no difference in between the two. And then my alternative hypothesis is that cavity rate in regular and non-regular patients are different and there is a difference in between the two. And this is an observational study, so there are no variables or constants. So materials and participants. So for materials, I use were x-rays of cavities to examine and study, and then I placed these findings into an Excel sheet. And the participants that I used were 15 regular patients and 15 non-regular patients that I got from Denture Express, who were all 18 plus. So for my procedure, I first got consent from Denture Express if I could use and examine their x-rays. I then gathered these x-rays and looked at them and counted the amount of cavities that each patient had. And then I placed them onto an Excel sheet, which is shown above, where it has the type of patient listed and then how many cavities each patient had. So for my results, I used a two-sample t-test to conduct my math, and I had a 95% confidence interval. My p-value was 0.004, meaning there was a statistically significant difference between the two. And my t-value was a negative 4.58, meaning that it was far from zero and far from my two values being equal. And as shown above in this graph, regular patients had an average cavity rate of 2.733, and non-regular patients had an average cavity rate of 5.733. So there is definitely a huge difference between the two. So for my discussion, my alternative hypothesis was proven correct, where the two groups did not equal each other, and then there were significant results between the two, as one was 2.733 and the other average was 5.733. So some limitations of my study. So I chose to conduct this study with participants who were 18 and older, and when I was doing some of my research, I saw where children and teenagers do have high sugar intakes, essentially meaning more cavity rates. So I think if they might have been considered in this study, results might have been a little different. I also did this study in a rural area, and in some of my research, it also said that rural residents have different healthcare habits, accessibility, and distance to travel, and 34% of rural residents and 27% of urban residents consider their oral healthcare poor. So that could have been a difference in why non-regular patients had a much higher cavity rate. And then lastly was my sample size. So due to Denture Express being on the somewhat smaller side, I was only able to get 30 participants total. So I think I think that there might have been a difference in cavity rate between the two if I had a larger sample size. So for future research, I would like to see this study conducted in a different area, maybe somewhere with a higher economic status, or I would like to see this study done between comparing cavity rate between urban residents and rural residents. And then I would also like to study time evolution of a cavity between regular and non-regular patients rather than just the amount of cavities to see if there would be a difference in that as well. I would like to thank Denture Express for letting me use and examine their x-rays for this study, and then I also would like to thank the judges and audiences for being here today. And now I will take any questions.
Lexi, good job. Okay, so I am someone with dentist anxiety, so thank you for including me. I was curious, do you feel like you could also be a good representation of your findings, as in like, do you go to the dentist regularly, and do you feel like that has helped you have fewer cavities?
I think it has. I actually just got my first cavity last year, and I always attend the dentist regularly, so I think me going and also them giving, because they always give you like the toothbrush and the toothpaste and the floss, and they always remind you to floss and brush your teeth regularly, so I think going is definitely a reminder to have good oral health care.
You were discussing the cavities. Are you counting only like active cavities, or were you also including like fillings that were previous cavities that have been taken care of? So that it would be a cumulative number?
I was just counting active cavities.
Okay.
Yeah.
Thank you, Lexi.